In our state alone, there are 900,000 residents who are 65 or older, and taking care of our elders has really become a crisis. Joining me now in Studio 61 is Mario D'Aquila, the Chief Operating Officer of Assisted Living Services. Good morning. Thanks so much for being with us.
Good morning.
And we're talking about a crisis. It really has become that. We're at that level. How serious for folks who maybe are not there yet? It's not a concern for them yet, but it really should be on their radar because their family members, their loved ones are going to be in that category in the next 5 or 10 years.
Absolutely. There's something called the silver tsunami coming about in the next decade that has actually started already, where aging individuals will be aging into the stage in which they're going to need some home care or some senior care. And there just aren't enough caregivers that are being attracted to the industry to actually care for these folks. So it's really important that companies like ours and legislators as well as trade organizations advocate for attracting sort of a younger workforce that can help care for these aging seniors in their home.
Now, you recently hosted a legislative summit to address the issue. Talk about some of the topics that were brought up and, share some of that discussion with us.
Sure. Actually, it's a very interesting time to be in the non-medical home care space because we're regulated by the Department of Consumer Protection right now. And last year in the legislative session, it was voted to, over the next 2 years, move homemaker companion agencies from the Department of Consumer Protection over to the Department of Public Health over the next 2 years. So although it'll come with some challenges, we really welcome the change because I think what it'll do is it will allow for non-medical home care to help assist with some things that will really improve the lives of seniors and to be able to really push up some of the things that we can do in the home to ensure that people can live at home as long as possible.
What will some of those challenges be that the shift will bring?
Anytime a industry shifts from one regulator to the next, there's always some overlap, right? So we're working with our state trade organizations such as the Association for Healthcare at Home and the Home Care Association of America to help assist with that transition. And they're working with the Office of Policy Management as well as the other regulators to make sure that that transition does go smooth and that no seniors are impacted negatively, and that caregivers are able to have increased wages as well as the care being provided is quality.
Yeah, I have to imagine it's a tough balance because you're talking about the people who are caring for our loved ones, but we want to make sure our loved ones are comfortable and they're getting everything that they need.
Exactly. And most people want to age in place, right? And where that's really important, we always advocate for increased Medicaid reimbursement rates so that it can keep up with ever-increasing inflation, as well as helping to fund so that we can pay caregivers a great wage and attract more folks into the home care space.
What are some important sort of topics that family members should be starting to have with their loved ones when it comes to assisted living?
I always advocate that if you have an aging loved one, that you really meet with an estate planning attorney sooner than later. It's really important to have all of your estate planning needs sort of in order because these types of things can happen really quickly, right? So it's
a good
really
point.
important.
Plus, you never know if there might be a shift in your loved one's health suddenly.
Definitely.
And if those ducks aren't in a row, then it's going to be more difficult.
Certainly.
All right. Thank you so much for being with us. Thank you. Really important update. We do appreciate it.
Thank you for having me today.
Absolutely.